I want to thank Margaret for pushing to have this joint meeting and finding the one available slot of time in the entire month.
This is a little sliver.
It's a crazy month.
Yep.
Okay, so, we're recording.
Yes.
Well, great, welcome everyone. This is our very first hybrid joint meeting between Health, Hospitals, Social Services, and the Special Committee for Racial Equity. We have talked about this meeting for several months now, and so thank you to Rabbi Kaplan and the committees for making it happen. Thank you all for joining. And really specifically, we wanted to be able to talk about the conversation that we've had over the last several months on combating hate and the implications of hate on health. So a couple of different things. We've had some iterations on what that could mean, what does that look like in the community, how do we play a role in combating hate, and more specifically, how do we take action? So one of the ideas that we came up with that both committees have been working on over the last couple of months is a resource guide for individuals if they have been impacted directly or indirectly by hate, and that could come in a lot of different forms of discrimination, bias, violence, perceived violence, or the threat of violence. And so we wanted to be able to not take a passive role, but look at individuals' self-preservation, if you will, and how individuals, the health of an individual as they are an active part or inactive part of the community, and what that does for our thread, our fabric of staying connected, of being able to contribute to our community, and what does it say about where we're going and what we're able to accomplish together to improve quality of life and service provision. That is the charge of community boards, making sure that folks are getting what they need. So that's like the impetus that I think brought us here today, but Rabbi, I'd love for your...
And it just so happens I also wear another hat besides my job, is I'm also a Commissioner of Human Rights. And we were just discussing it earlier today at a commissioners meeting. The issue of hate has really risen to a level unprecedented in the city since the creation of the commission. And there is a doubling down on the part of the administration to really do as much as they possibly can to fight hate. But hate has become ubiquitous and seems to be unabated in its rise. And it has so many different iterations going on right now. I think it's important that we begin to help people unpack it. From a health point of view, there's such trauma, from the fear factor of hate and the fear of what it implies, whether it's what's happening on campus right now. For a lot of people in the community, it's fearful of being able to walk onto a college campus, or being fearful of being able to walk on a street. I was just on a call. We're going to be doing an implicit bias training for the DOE. I was on with two Muslim friends of mine, and their community is racked by this, as is the Jewish community and other communities. So I think it's important that we unpack it for folks, that they understand what it looks like, how it operates, unfortunately how normative it has become, and what are the resources out there, apropos to what Margaret just said, what are the resources out there that can help people deal with some of these issues, or at least report when it does happen to them, or happen to someone that they know, because one of the real lackings in many communities is reporting. There's a real lack of reporting in many different communities because of multiple and complex reasons. So I think people need to understand that and how they go about doing it. So if we can provide that service to the community, I think it would be really quite excellent.
If there's lack of reporting, then the situation may well be even more severe.
Oh, it's much more severe than,
All the records and indicators suggest.
Yeah, just to give you an example, a friend of mine, leader in the Muslim community in Brooklyn, did an informal study around incidents of hate, not necessarily hate crimes. And I think that's one of the things we can do for the community is to really, begin to unpack for people what's the difference between an act of hate and a hate crime, because they're two very different things. One of the criteria for that. And he did, again, this informal study, and he had hundreds of unreported, attacks and verbal attacks and other kinds of issues around hate in the Muslim community. Happens to be in Brooklyn, where there's a large South Asian Muslim community, and all this stuff's not reported. So yes, the reality is that if all the stuff that's happening on a regular basis was reported, the numbers would be that much more stark.
And I think, certainly when there's a way to, we have an imperfect system, so even if numbers or even if incidences are reported, and validly there's skepticism about what would change or what could be different, but at least it gives us an opportunity to truly understand what folks are enduring on a day-to-day basis and use some aspect of the law to try to bring some sense of justice or at least some accountability for hate crimes or other things related. So, I think some of the feedback that I got initially on this, or at least one piece of feedback I got was, so what is the urgency? Why are we sharing this resource guide, and why are we doing it now? And so they suggested a preamble, and one of the things perhaps that you may want to link to is the annual report, and this is an opportunity where it hasn't been for the last 5 years, but there have been 5 reports. One was an initial report, and then we've had interim reports thereafter. But this is our 5th iteration of that, and so I think it's all in one document, so we can see each year what have been where has the committee been, what are the conversations we've been having, and we have an executive summary for each of those years where we add on additional information that could be a piece of urgency. And one of the pieces that I guess I've wrestled with is sort of the call for conversations, and I guess it was a bit of my frustration or perhaps feeling exasperated that conversations are always necessary, but sort of like the dais of conversations where people are speaking to a crowd or perhaps people on Zoom, it felt almost like it wasn't really looking at the individual and how the individual is taxed in the moment and over time and over months. And so I don't really have a point other than to express some of those feelings or the feedback that we've gotten thus far. But I don't know if any other committee members had anything else that they wanted to share about the urgency or the why or any other things we haven't addressed yet in terms of the purpose of convening this conversation together and the resource guide.
Hi, Margaret, it's Kelly. Yes, I will say that there is an urgent need to address this, and I speak from the position that at last month's TNT meeting, someone actually came to the meeting and wanted us to consider building a wall or some type of barrier at 262nd Street and Broadway because of their fear for the homeless people that are going to be in the area. And so I think, that is something that we have to message that cannot be tolerated.
That is remarkable.
Yeah.
That's the only way to describe it. Well, listen,
Well,
you,
you had to be in the room to see all of our faces, but yeah, it was really a sad moment for us as a community.
so the feelings that are going to happen are only going to be exacerbated by this year's election. You know, leading up to November, it's just going to get worse and worse and worse. I'm not going to become political about it, because that's not the purpose of this. But there are people who are using hate as a tool, politically and otherwise. And on the other hand, on the flip side, when does this report due? Or what's your timeline on the report?
At the end of this month.
In this month. Congratulations. Well, I do know that July 2nd is the 60th anniversary of the Civil Rights Act. And I think that tying it into that would be a very, very important piece, because unfortunately, the Civil Rights Act is under siege as well. And having people understand that things like Title VI, which protects kids in schools and all that kind of stuff, are really on the edge of not being available. And I think that we need to let people know about that, not just as a political advocacy way, but just as informational.
So Margaret, the report has not circulated outside of the SCREE committee at this point, is that right?
Yeah, the resource guide has I've shared that with this committee and with SCREE, as well as chairs of all the committees of the community board. So the executive summary and the updated annual SCREE report has not been circulated. I've really been struggling with the executive summary this time around. It, you know, perhaps some expression of, we won't say hopelessness, but, you know, this is what humans do, and this is the cycle that we're in, and this is the point in time that we're in, and this is where it requires us to have a backbone and all of those things. And so all the things that SCREE has been commenting on over the last 4 years, you know, it sort of feels as though we're at a crescendo moment, if you will, and sort of feeling like being able to capture this moment is proving to be difficult.
So but the resource guide has circulated.
Yes.
So have you, because I know that members of the committee have exchanged opinions, have you heard back from other committee chairs or gotten other feedback on it?
Only that one person did ask for the, sort of a framing of urgency around it. And so, I guess that's something that we could debate, or there's also the option of linking to the SCREE report to give some further context if people want it.
I just want to say, I think that is a really important document, that resource guide. I think it contains, in you know, not too many pages, valuable information on, for instance, what is the difference between a hate crime and an incident? What do you do? Where, you know, where can you get help? Where can you report? I mean, there's a wealth of information in there, and I would certainly like to see that document circulated as widely as possible. Everybody on the community board, and I hope widely in the community itself.
Yeah, definitely.
And it's, you're the one who put it together, and you know, it really was a tremendous accomplishment on your part.
The one thing that well, thank you for saying that. The one thing I do think is missing from the document is art and the opportunity for expression. You know, all things being considered, that, you know, you can engage law enforcement, you can work on your mental health, you can get all these programs and services that are about sort of mandating the situation or really addressing some clinical repercussions of what you've suffered or perhaps that you've been perpetrating. And is there a place or space for just emotionally moving through this landscape. So
Mhm.
while you can be so action-oriented and sort of like, you know, oh, I've done this for myself, or I've done this in the community, I've gone to protest, I've, you know, reported a hate crime that's been perpetrated against me, I've reported a landlord who discriminated against me and my family, and now what? You know, sort of time is still required, so in what other ways can we support the individual, while they're moving through these systems and the arc of justice, if you will? How does one sort of cope in that moment beyond sort of doing all the things right?
Mhm. Yeah, so, you know, therapy, that sort of thing. There are I mean, you know, this is a big issue for veterans, of course, PTSD. There are various kinds of therapy programs, art therapy, music, you know, various kinds. So, yeah, you know, maybe a little bit of information about that, you know, about that sort of thing that might be open to a broader, set of, victims, for want of a better word.
Ways of following up. If you don't hear by X time, this is what you can do. Ways to follow. For example, if it's in housing court, how do you follow up on that?
Well, that's something, you know, like, again, the Commission on Human Rights can help. There's a whole enforcement piece there. What I hope we can do today in this joint meeting is sort of outline, pick a date or an approximate date to do this. We're talking about an online type piece, so it'll be available to as many people as possible. And really outline what a forum would look like, what it would like to, what we want to have it address, and who we might want to invite to do some of that education for folks. And yeah, I think having a piece built into it about what the next steps are and what the resources and maybe a whole illumination of the resource book, really going through it and understanding what's available here. There are a lot of, by the way, there are a lot of good things happening. I mean, for instance, the Department of Education is putting together a whole new curriculum called Hidden Voices that's going to be really addressing the issue of hate and all these various different things on many, many different levels within the Department of Education, to have people talk about that, and have different agencies within city government or the DA's office talk about what, you know, their hate crimes work that they've been able to do. You can certainly have the NYPD come in. I don't think that you're going to, you know, hate crimes intervention is generally seen through the lens of law enforcement, and I just don't think that that's the best way to see it, because that's only after the fact rather than, you know, before the fact. However, that's a reality as well. So just lining up who we think would be the right kinds of people and what's going to address the right kinds of issues, and sort of taking the temperature, letting people know what the temperature is out there, you know, and where we see things going. Unfortunately, we don't see them going in a very positive direction. I think it's going to get worse before it's going to get better.
I could imagine that, you know, this is a report that at some point we put on the website, on the community board website, and over time it will probably be updated. You know, there will be changes. We'll discover new programs. We'll learn about agencies that we don't know about right now, that sort of thing.
And
So,
others die.
I'm sorry?
Others die.
Yeah, and right. So, you know, it's sort of an ongoing project, but at a certain point, as Margaret was saying, you know, the committee will have to issue its report, and the resource guide will be linked to it, or part of it, or however you choose to do that, Margaret. But, you know, then it would be the sort of thing we'll revisit over the course of the next year and afterwards.
So if we can just start to look at sort of the nuts and bolts of what we're looking to see happen and when. Obviously not during the summer. I don't think that's going to get your best audience. It might be an excellent time to do it right at the beginning of the school year. And I would have an education focus on it, because I have a hunch that the campuses and the schools are gonna be hotbeds of some really tough times. Really unpacking that and letting people know what's happening and what some of the interventions that are being thought of, both from a campus and from a Department of Education, you know, private schools, because the story about Fieldston and the story about, I don't know if you know, Bronx High School of Science, had to walk out last Friday, and people are nervous. I think that, you know, in the beginning of the school year might be the perfect time to do something like this, to give people kinds of opportunities and resources and information that they can have to begin to deal with this effectively.
I do think there's a number of holidays, religious holidays in October.
October is a non-starter.
So maybe if we did something in September,
Yeah.
after the first 2 weeks of school, perhaps, as, you know, folks get acclimated back into their schedules. Maybe something at the end of September, mid to late September.
Let me just
You already are booked.
Let me just take my schedule, because I know I already have some travel already.
Does this seem like something that's compelling, to have a community conversation on this and perhaps walk through,
Different resources, and maybe we have, like, in our resource guide, we use that as sort of our map of people who would like to come and speak, and just, you know, maybe it's a 10-minute presentation on what's available, for whom, how do you access it, why.
I have a question. May I ask a question? It's Mariam from MGHS Hospice and Palliative Care. May I speak?
Please.
Yeah. Okay. This is a joint meeting between the Health and Hospital Committee and the Committee on Racism. Are we addressing at all what's happening in the healthcare arena in terms of not of inequity and prejudice and refusal to serve and to take care? I'm wondering if the health part from the Hospital and Health and Social Agencies Committee is playing a role here too, or whether this is just a separate kind of a concern that we have.
We were sort of more looking at the issue of the impact of hate on people's health, on the issue of trauma and people's health. The inequities in delivery of services goes across the board. I mean, this is just, you know, built into society. The fact that the Bronx is the 52nd or 53rd county out of 53 counties on delivery of health is no guess why. So I think that the issue of healthcare disparities can be certainly taken a look at. We can make it a piece of it. However, we're really talking about the impact of trauma and hate and fear.
Yeah.
I can only, I see you work for MJHS, I can only imagine that older folks are re-traumatized, particularly those who have been through various traumas in their lives, are re-traumatized on a consistent basis by what's going on in the world.
Correct. Refugees of all nationalities, of all backgrounds, of all religion. If you've been traumatized, this re-triggers.
yeah.
So I'm glad, thank you, Rabbi, for clarifying.
So over the course of the last year, we've had several conversations, like especially maternal care for women and women of color specifically. I think we've looked at a couple of different health disparities about resources and access in the Bronx. But could you be more specific about, is there any particular community that you're thinking of? And I think probably the option of talking about ageism and other sorts of things that take place within care facilities as well. I think that's also something that we'd like to explore.
and the abuse that might go on financially or otherwise, for older adults or individuals with disabilities, and individuals who might be recently emigrated to this country, et cetera.
I was confused about the direction of today's meeting or the mission, so to speak, of the topic that was going to be addressed today. Look, do we see traumatization every day? Do we see prejudice? It's not just in maternal health. It's when a home health aide comes with a head covering and the patient, or it could be a nurse's aide or nurse, and the patient does not want to be taken care of by that person because of a prejudice or fear or a past trauma. So we see it play out all the time. And I think the intervention and the education has to happen as much upstream as possible. And probably needs to involve stakeholders in the community, like faith leaders, legal person, how do you call, politicians, and other people who have a voice in the community that people trust, so that they can start with the education in a much smaller setting, and that people carry that out into their, that was my concern. But I understand that you're looking at it from a different angle, that you're looking at how it affects health and mental health and can re-trigger trauma if prejudiced against or persecuted or abused in any which way. So it's just two different angles. Thank you for clarifying.
Yeah, and those are part of the ongoing conversations that, HHSS has throughout the year. But today is just a special conversation on the resource guide and et cetera.
So again, if we're probably looking at the last 2 weeks in September. What evening of the week, we have to see when it's scheduled to have our meetings, but we have to figure out what evening of the week would be the best. Evening would obviously be the default, so that people can attend. And we can speak to the folks here, what their scheduling is. I don't know if they've already scheduled September. I imagine they have. And Margaret's right. The month of October is a non-starter. It's just all these crazy holidays. Question is that, let me just throw out a suggestion, is to have maybe a person come on, or on Zoom it's hard to do panels. It's just hard to do. But if we could have one person come on and sort of give the temperature of what's out there, the lay of the land, what we're seeing as far as hate, and I'm not sure the same person can do the impact of hate on health, but certainly have someone come up and do the overlay on hate within the context of our society and hate acts. I think would be a very helpful thing. The person who spoke to us, the director of the Office of the Prevention of Hate Crimes, has left his office, so we'd have to find somebody other than that, but there might be some other people out there that could really do a fine job of really laying out the parameters of where hate is at within our society. Is that something that you all feel would be a good way to sort of start it off? First of all, how long do you see this thing happening? How much time do we want to give to it?
Are we talking about a joint meeting again? Is that?
No, this is an actual, like, a conference, online conference.
Oh, okay.
Yeah.
If it's in the evening, I would say 2 hours.
2 hours, okay. Like a 7 to 9 type thing?
Yeah.
Yeah.
It doesn't necessarily have to be in the evening, depending on our target population.
Yeah, I mean, that's when there's the greatest availability, generally, it's in the evening, yeah. Mhm.
So I think 2 hours is the max.
Mhm.
Okay. I think that it might be, so maybe two people come on, and one could discuss it from a health point of view, and another person can discuss it just from an overall, the state of hate,
Yeah.
a societal point of view, yeah.
So now we have to find those two people.
Well, there are some, like I said, there are people out there that can certainly speak to this. I was really hoping that Hussein Rashid, no, name just went out of my head. But the person who was the head of OPHC, could be the right person, but, like I said, he left recently, so he's not available. We could probably get somebody from, as I said, from the Commission on Human Rights to talk about it. They may have a person in place, the new head of OPHC at that particular point in time. Trying to think of who. Here's one suggestion. It's an interesting point of view. And somebody, we have a number of fellowships. In fact, last night was the graduation of the first cohort of the We Are the Bronx Fellowship Against Hate. That's housed out of the Y. It's a replication of a program that's been going on for a number of years now in Brooklyn called the We Are All Brooklyn Fellowship Against Hate. There's a professor at Columbia University. His name is Peter Coleman. Peter's written a book called The Way Out, Toxic Polarity. He talks from really an academic point of view, state of society. And it's all data driven. He's not just, pontificating. He just talks about how we are in the middle of a society right now that is so polarized. We have not been this toxically polarized, as he points out, since 1861. Which was the year that
He's a political scientist, I'm
he's
afraid.
actually a sociologist and a psychologist. So he talks about it from those points of view. I'd be more than happy to share a video with the committee that you can take a look at and see if this is the kind of person that we'd want to. He would lay out a very broad, not very community specific, not city specific, but societally specific points of view about what's happening and why we're experiencing this now. And this notion that we don't just see the other as having a different opinion. We don't see them as just, somebody who likes things differently. We see them as the enemy, somebody who needs to be destroyed. Not just, corralled in or spoken to, but somebody who's representative of evil. And that's sort of where we're at right now.
Yeah.
Very unfortunate, but that's sort of where we're at. So that might be one way of doing it. I personally do not know anybody. I imagine we could find some folks that could talk about the impact on health, and that's something that maybe someone from DOHMH, the Department of Health and Mental Health. I don't know if there's anybody. You have your doubts.
I've become jaded. But yeah, I think.
Yeah, I don't know anyone over there that could speak to this. There's people who are speaking out to the whole issue of mental health. But I don't think that they've really thought about the impact of trauma and hate upon the health of people. And there's some real interesting studies that have been done at Einstein about intergenerational trauma from hate. Some people of the African American and from the Jewish community because of both the Holocaust and slavery and racism in America. So we could search around and try and find somebody who can really speak to this from a health point of view.
Yeah,
There's higher incidence of a lot of not only mental health but physical health issues.
Yeah, there's a lot I think on trauma like PTSD. on
Mhm.
overall health. But hate is a much broader thing, and the kind of thing we're looking at is a much broader, more nebulous thing. I would start the conference actually on the difference between hate crime and an incident. People are grounded. And then I think we should have a definition of what we're covering in terms of hate. I'm not being very articulate.
It's actually, might be just the way to start, having someone come in and just talk about hate. What is hate?
And how it's different from trauma. Because I believe it is.
How it's different from what? I couldn't hear. You
I'm
said
sorry,
it's different, hate is different from what? I couldn't hear.
from trauma, from
Trauma.
trauma,
Okay, thank you.
of course.
So having some definitions right in the beginning.
Yeah, some framing. You have to frame the issues first, I think.
I do like the idea of somebody who's an expert who can speak to the fact that it is a greater problem now than it has been in a very long time. You know, everybody's tendency is always to assume that whatever the current situation is unique in some way, when, you know, very often it isn't.
Mhm.
But in this particular case, it sounds like, yes, we are in a situation that's maybe unique is the wrong word, because there's a precedent, but the precedent goes back over 150 years. So, I think that should be part of the initial discussion as well. The problem, yes, the problem is as bad as you think it is. In fact, it may well be worse.
Yeah, and I agree, starting the conversation on hate, how it's different from trauma, perhaps PTSD, and also how it's comparative, physiologically to PTSD or stress or trauma, sort of how the body reacts. While it's different, it also triggers a comparative response that impacts overall well-being.
I think that would be very helpful. So we begin with a framing piece, then more of a sort of a next dive in to sort of taking the temperature of society and understanding that, and then look for someone who could talk about it from a health point of view.
Mm-hmm.
Just don't know anyone today who I've heard lately can do that successfully.
There's a raised
Okay.
hand. Sebastian wants to say something.
Bastian, yeah, please.
Yes, just wondering if we can also have someone. I think it's incredibly difficult to prove hate crime, and I think it's very challenging when something has been reported as a hate crime, and for someone to get convicted of hate crime. I don't know the numbers, but I believe it's very challenging. So is that because the reporting is not clear enough, or we are providing resources for people to reach out, but maybe there should be a legal viewpoint. I don't know if it's the AG's office or someone providing why it is challenging to prove hate crime. And if people are not really getting convicted after committing a hate crime, then we are not able to make any advance in this, right? The progress depends on people who are committing these crimes getting convicted. So I think it will be helpful for the public to know how to properly report it, and the legal way. So I don't know if the AG's office or someone with experience in this field can provide some tips to public.
So I know that DA Clark has a hate crimes bureau, and I think that they could probably address this well. And just from my experience, one of the reasons you have such a hard time convicting someone of a hate crime is because according to the statute, you have to prove without a shadow of a doubt that the crime, it has to be a crime. It's not, hate crime is not a category. It's a crime, it's a physical crime, that was committed because of hate and no other reason. The initial reason for the commission of that crime was that you hate somebody because of the category that they fall into. And it's not because you wanted to rob them, it's not because you wanted to do something else, it's because you hate them. So it becomes that much more difficult where if the crime happens, for instance, we've done this with some of our fellowships, they give scenarios. So if the crime happens and somewhere during the crime, somebody starts using racial type epithets or religious epithets, it's not a hate crime. It's because it devolved into that, but it didn't start there. So I think people need to understand that, because people are quick to throw around the term hate crime when it's not a hate crime. It may be a crime, it may be hateful, it may be both of the above, but it may not rise to meet the criteria of a hate crime. And I think that you're right, Sebastian, for people to understand that, because it would cut back on a little bit of the apprehension about, well, why wasn't this convicted? The conviction rate is very low, by the way. It really is.
Yeah.
Very hard to prove that it was, I hate you and that's why I've committed this crime. Maybe one of the things we can add is, this is a hate crime, and give some examples, and how the courts see it, how the courts have interpreted that.
Right.
So a lay person can look at something, what are the indicators? I know, what are the behavioral indicators that the court has accepted as, yes, this is a hate crime?
And there's all kinds of layers there, by the way.
Yeah.
The way it works initially is that when there's a suspected hate crime, it has to be the sergeant that has to come in and look at it, and then they have to report it to the captain. Captain then has to make a determination. They then get in touch with hate crimes, and then they get in touch with the DA's office. And ultimately, it's the DA's office call whether they may be investigated as a hate crime, but it doesn't necessarily mean it's going to be prosecuted as a hate crime. So there's a whole bunch of layers that you go through on this kind of stuff.
So we have a conference already here. We've got, we've got the sociological overview of the magnitude of the problem. We've got the mental and physical health aspect for the individual, and we've got the legal issue of, what is a hate crime. So right there, we've...
Right, that's a pretty full agenda, and then someone at the end that goes over the resource guide. He talks about the resource guide and what's available and all that sort of stuff.
You do, I think after identifying and describing the magnitude of the problem, you really have to give people some solutions, some potential solutions at the end. That's a good point.
Mm-hmm.
So, getting it right, it's hate. We start with hate, a definition, and then an overview both from a sociological and a health point of view, and then the legal aspects, law enforcement, etc. Then a guide or solutions, and that's an evening. That's a lot of stuff.
I think you might need a moderator. It depends if you're going to have them sitting on a panel or if you're going to have one present after the other. But if it is a panel, it's good to have a moderator and maybe have some questions prepared so that they can respond to where we see our gaps in knowledge or gaps in information or whatever.
Well, we certainly have to have a moderator for this, or moderators for the evening, but I would imagine that we have, panels are hard to do on Zooms. They're just hard to manage. So, it can be done, but, I would imagine you would have, maybe the only panel would be both the sociological and the health aspects. And then, you know, Q&A after each and every section. So I'd be more than happy to write this up and get it out to the committee so that we see, outlined. Then we just have to identify who the speakers are gonna be. We'll find out from the office here what dates are available those last 2 weeks in September. And, we'll have to call upon people to, I think the hardest area that's gonna be to identify is going to be the healthcare aspect.
And
There
who
are
is
people
the
who are
targeted
studying-
audience, Rabbi Kaplan? Who is the targeted audience?
The community, it's just the community overall.
Okay, so
yeah.
it needs to be broadcast and it needs to be endorsed by different organizations within the community. And what if we have a big response? Where would we seat 30, 40, 50 people? Let's say we have a good response. Who's gonna host an evening like that?
Virtual.
Virtual.
And the
But
sponsoring
you,
organization.
but you
is the
just
community
said it's
board.
hard, but you just said it's very hard to do it on Zoom.
No, I said it's hard to do a panel on
Oh,
Zoom.
okay, okay, it would still be virtual.
Yeah.
Too bad. It would be nice if
I
we
mean,
get
you'd love to
together.
do it, you know,
In
it's
person.
best to do it in person, you're just not gonna get the people out to something like this, you know?
It's hard to get people.
I mean, for parents and for all different kinds of folks, and having them show up is gonna be difficult.
We're talking about something that's 3.5 months away. This is, it's gonna be challenging to pull all this together, to find the experts and, you know, and for them to be available on whatever dates we have, because we're limited in the dates that we're going to be able to propose.
Right.
So there's, this is going to require some real effort to pull this all together.
100%, so, we can do most of this online, on emails, you know. Like I said, I'll be more than happy to write this up as a sort of at least a draft agenda for the evening. Some of the speakers, you can already begin to figure who might be some of the best speakers, and then there's gonna be a few ones that are gonna be hard to find. Like I said, you know, for somebody from the legal point of view, speaking to, you know, turning to the DA's task force on hate crimes might be the best place to go. I know, what I understand, and I spoke to the head of hate crimes in NYPD, they're reluctant to go on these things anymore because of all kinds of legal stuff that's been going on lately. They've been getting challenged all over the place. They used to be much more open about it.
Artie, do you think, there's any chance of finding out what dates would be available?
I'll discuss that with Farah.
Okay. I think HHS is scheduled, or if we kept it on the same night, is September 11th.
I think, that's not a great day,
And it would be too early in the year, I would think.
Yeah, towards the end of the month.
Mm-hmm.
I know I'm traveling from the 15th to, I believe, just a second ago, to the 23rd. So, you know, I'll be back on the morning of the 23rd, so any time from the 24th on, because I'll be overseas and my brain probably will not be working well in the evening.
Okay. So the 24th, 25th, 26th, or 30th?
Yeah.
Those are our options. Okay.
And like I said, the Office of Prevention of Hate Crimes may have a new director in place. They've already been without one for about a month, and it's starting to show, so I know they're in the middle of interviewing right now. Margaret, what's been your What's been your experience with DOH on these kinds of issues? This is not good?
Maybe that's a sidebar after.
Okay, it's a sidebar, okay. Don't want to record it.
That's right,
You got
it's
it, gotcha.
recorded, yes.
Yes.
Great. Well, does anyone else have anything they'd like to
Add or discuss? I will,
now with a new formed brain, I will send out the other screen materials that I know we want to be able to review and, have an interim report by the end of this month.
but anything else that folks would like to discuss or contribute?
We've got a lot accomplished here.
No, thank you. Thank you very much for this meeting.
Thank you. And thank you all for joining us on an unconventional time, at least for both of our committees. We appreciate you.
Thanks for being here.
Thank you.
And thanks,
My
have a good
pleasure.
day.
Thank you. Have a good one.
Thanks a lot.
Take care. Bye.
Thank